The public sector strike has been marred by violence and intimidation, and it's now impacting various hospitals, including Charlotte Maxeke Hospital. eNCA's Moloko Moloto is there checking on the situation and joins us live now to give us an update. Moloko, good morning to you, colleague. What can you tell us on the ground and the impact on this public wage strike, particularly on hospitals?
Well, good morning, Tim. Of course, we are this morning at the Charlotte Maxeke Hospital in Johannesburg as the strike by the members in particular of the National Health and Allied Workers Union are embarking on their strike. Mainly, it is affecting hospitals and other health facilities. We heard from the Minister of Health, Dr. Joe Phaahla, last night, saying that the provinces of Gauteng, KwaZulu-Natal, the Eastern Cape, and parts of the Northwest Province, particularly in the Klerksdorp area, were hit hard by this particular strike. And he was also lamenting the fact that in many instances, workers who decided not to go on strike were being prevented physically from going into or reporting for work. But also, he said there were reports where patients were also prevented physically from going in. One other incident that he described as inhumane, the minister, was that here at Charlotte Maxeke, patients were at some point left without food because the people or the staff members who were inside were few, as many of those who wanted to come in were prevented. And he described that as inhuman. This morning, as you can see, just a few number of protesting Nahau members outside the gate, and we've been observing workers who are not on strike. We have not seen anyone preventing them from going in. And a short while ago, the Minister, Joe Phaahla, along with the Premier of Gauteng, Panyaza Lesufi, as well as the MEC of Health, they were here essentially just to greet these striking workers, telling them that they are working on addressing their grievances, but also urging them not to stop those who are not on strike from going in. I am going to ask my colleague Teddy to stop here so that we can speak to this gentleman. Sir, thank you so much for making time. Yes. Earlier on, you were addressing the Minister of Health, saying that you are angry at the fact that, in your words, you as the workers are being oppressed by the government that is led by black people. What did you mean?
Sikhiphe i-apartheid from 1994, so 2023 now. So the gains besizithole kwi-apartheid now reversing. So we're not going anywhere with government wethu. Why comrades zethu sizideploy parliament, but now they are letting down us. So that is why we're not happy, because first, increment, we last get what's called increment with 2019. 2020, they failed to go to honor agreement. Resolution of 2018. As I told him about 2020, for 2021, by introduce I graduate.
Yes.
That graduate by Tata this year.
I'm just going to ask you to speak a bit louder for me.
Okay. Go 2023, they said by Tata he graduate.
Yes.
So last year, 3%.
Okay, we don't have much time, but I just want us to speak about the impact of this strike. You as the workers, you have a right, as you have been saying, to go on strike. But surely you don't have a right to prevent the patients from accessing healthcare centers and those workers who do not want to go on strike from going in.
No, unfortunately, sir. Because even the police officers will tell you what happened yesterday, even today.
In other areas, yes, but you are a worker, and in other areas there are people who have been prevented. Yesterday the minister said here You workers who are on strike prevented them. Do you care about the people who have no alternative? They, unlike some of you, they don't have medical aid to access private hospitals. Do you care about them?
It's a big blunder ukuthi amanga ukhunywa kwimedia ukuthi thina prevent abantu yesterday. Sivulela wonke umnangena ama-doctors and so on ngaphakathi. So that is why there was no problem. Even the nurses abebewafuna kuma-deal ama-suction points and maternity wards bahambile amanesi oseva abantu onceda abantu bangasivale abantu. Even na today uyabona kunamuntu ovaliwe. So there's no way ukuthi thina kuyiblame ize kuthi.
How then do you hope to resolve this? I mean, you just a few number of you. I don't think you're over 50. How are you going to sustain this?
No, because we started picketing Monday and Tuesdays. Then they expect to yesterday even tomorrow, don't know what will happen tomorrow. So Tina, we know good to intensify strikes. Yes.
All right. No, thanks, Baba. I think I must just get a few more other people. Sister, hi. As workers, how are you going to sustain this strike, considering the fact that on the one hand you say you want your money, but on the other hand the people that you have chosen to assist when you chose this career are suffering? How do you balance the two?
I think at least we choose, I'm sure, essentials. I'm a wardin, I'm sure really sister in charge and 2 nurses or even 3 nurses at least or to cooperate, and even in the boiler remember to way 1 way 2 way 1 was I shifting way 1 was or even though striker and then come everything is okay, and then but and the patient right because to ribatang as the patient to ribatang salary increase because as well everything is up. Universities are up, and then rates and
cost of living is high, we understand. But here is the thing, there are reports that patients in many other centers have been prevented from accessing hospitals. Your colleagues who are not on strike are being prevented from going in. Some of the patients, we are told by the minister that they were not able to get food. You as a healthcare worker, how does that make you feel to hear that people who are vulnerable may die, are in that particular vulnerable position? How does it make you feel?
I think in our hospital, the information I'm sure is wrong because it's peacefully strike, and the other...
What about in other hospitals?
I'm not sure by other hospitals.
No, I'm saying the situation that is worsened by your colleagues in other hospitals who are not allowing patients from going in. How do you respond to that?
I feel that maybe if ever a communicator or meetings, but and then managers, but way easy way. We have to plan. If ever global strike, we plan first, and e-communication is the good idea because everything is.
All right. Thank you, sir. Thank you, ma'am. I appreciate. Well, Tumelo, as you can see, there isn't much at this point in time. Less than 20 people picketing outside the Charlotte Maxeke Hospital. And of course, the minister has said that he's going to be visiting 3 or 4 more hospitals around Gauteng. And when he returns after an hour or 2, he will then be briefing members of the media about the situation in Gauteng.
We'll leave it there. Moloko Moloto out for us in Charlotte Maxeke. Rather outside, we can see some protesting union members saying they want a wage increase that is satisfactory, but also that matches the cost of living in this day and age. We'll be sure to catch up with Moloko Moloto, perhaps when we get a chance to speak to the minister as well as the premier.